I'm smart.
So particularly to this, I would look at the front, the side, and then I would turn it over. I'm not going to turn it over right now, but when I do the test, I will. But basically, if I was really doing it in order, I would look at everything. So I'm looking in the front here. I'm trying to think. I want to make sure I don't forget anything here. So I'm basically looking at all of this. I used to, in the test, have you guys actually tell me what you're looking at. I'm not going to do that anymore. I'm making it simpler, but you really need to know how to do the things I want to do. So if I was palpating, I would start, again, if I was just an ankle, I'd go, okay, if it was the foot, I would start checking everything in the front here. What?
What?
No. No. Why do you just do? Jeez, you guys are crazy. So I would palpate along here. I would see if she hurt this over here. You see what I'm saying? That's on the lateral side. I would go up the side here. I'd go up the back. I'd check these bones, and I would come around, check the front, top, over the top, and then the side. I would go ahead and check all this side. So again, even though I don't know what everything's called, I just want to know where everything is, and then I would turn it over and palpate the back. So I'm not going to, like I said, focus on that as much for your test. So now I'm going to do active range of motion. So what do I say to her?
Move your foot.
Move your foot which way?
Up, down, left or side.
Okay, so breathe. Okay,
Oh.
you're hurt.
Oh my God.
No. Stop it. I'm sorry. No. Okay, so bring your foot up. Bring your foot up.
Oh.
Okay.
Oh,
Now,
that was hurt.
Now, could she bring her foot up by using her leg? Probably. So it's real important. I say, okay, I hold this here. So she's not using her leg at all. Only her foot. Okay, bring your toes up to there. Good. That's active range of motion. That's called dorsiflexion for those of you who don't know. Okay. Now, how would I do plantar flexion? How would I do pointing? I would say. Okay. Now, the problem is that if she's really hurt, and she showed me that she does it pretty well. But what if she couldn't do it? What was going to happen anyways? If she held it here and then I said, okay, bring it down here, what's going to happen whether she has muscles or not? It's going to drop. So I cannot test plantar flexion or pointing in that direction because gravity's already going to do it. All right, so I need to actually have her turn over to check this. Everything needs to be done against gravity. So if I tell you, I want you to check active range of motion, you can say, bring your foot up. Okay, bring your foot in this way. Bring your foot out that way. Okay, she's doing it really well. If I tell her, I want you to invert your foot, most athletes, most people are not going to know what I'm talking about. So when you tell them, you need to say, I want you to bring your foot in, and I want you to bring your foot out. What if my hand's not here? Okay, I want you to bring your foot in, I want you to bring your foot out. What's the difference?
She's rotating.
She's rotating her knee, so I don't really know if she's doing it from her ankle. So when you do it, it's very important to stabilize what you're trying to do. Bring your foot up, bring your foot this way, bring your foot that way. Okay, now, if I know she's really not hurt and I want to kind of bypass the whole gravity thing, I can just have her now do resistive. And if she's good in resistance, then then gravity won't make any difference. You'll see that. Okay, now, if she couldn't do that or I want to check it passively, then I would bring it up this way. And then I don't really need her. I would bring it down this way. I'd hold it here. I'd bring it this way. I'd hold it here, and I'd bring it this way. Okay, so you have to do that. You have to hold it and stabilize it and make sure I'm not doing this and this because that's not good because her knee's turning. Okay, so passively you have to do that, this. That I can check all of this without her turning over. Resistive. There's two ways, and I should, on your handout it says end range of motion. You kind of got all confused probably when you saw it. There's two ways for me to check, for example, dorsiflexion. I can either start at the end and have her pull up. Okay, so pull up as hard as you can. Okay, actually that was starting at the beginning and having her come up. Or I can start at end range of motion and say, okay, I want you to put your foot up here. I want you to hold it there. Don't let me push it down. Those are two ways that I can check dorsiflexion. So I either can have her start at the beginning point and come all the way up to the end, or I can say, hold it here and don't let me push you down. Those are two ways you check range of motion, okay? I think it's easier in most things to have them start here and go up, but it's up to you. Either way, you would be all right. Okay, then on this one, so for pushing, okay, push against my hand. Again, gravity's not an issue anymore. So if she can do that, then I'm not real worried about turning her over and doing that. But for all intents and purposes, if I ask you to do it, you need to do that. Okay, go ahead and push in, as you can, and push out. Okay, so I either go push out, or I have put your foot here and don't let me push it in. Either way, but that's the two ways to do it, all right? So I've done active, passive, resistant range of motion. Any questions on that? So you'll look at that. So if I tell you I want you to do active range of motion in the ankle, you're going to do all of that, and you're going to say what? I'm going to do what? What are you going to tell me first before you do it? I'm going to check both of these. And if you say that to me, then I'm not expecting you to go up and back and check it bilaterally. I just want you to tell me you're going to do that, okay? So I'm going to do the same things for the other foot. You get 5 points. Check it off, okay? So range of motion, you've got plantar, dorsal, inversion, eversion. That's all there are there. Ligament test. Okay, anterior talar fib. Some of you remember that name, some of you don't. There's an anterior drawer test. So you saw that. Again, the importance of that is you grab the foot, you hold the other one, and you come forward. Think of a drawer coming out of where it's sitting into, what do you call it, a drawer coming out of the dresser, whatever you call it. Okay, so you hold this, do this, whatever hand's easier for you, you hold this and you pull forward. This ligament, if it's loose, it'll go farther. Okay, so that's the anterior drawer test. So if I say I want you to check the range of motion, I want you to check the ligaments of the ankle, this would be the first one you would do. We do the anterior drawer test where you're pulling. Doesn't need to be perfect, but I'd like you guys to practice and try to actually do this. This is the same thing I would do if somebody had an ankle that wouldn't go past here and I needed them to walk, is I would grab it and I would mobilize it the same way. So the drawer test is mobilization, rehab, looks a lot like testing the ligament, okay? So I would pull it this way. Inversion stress, we've already done that with passive range of motion by doing that. Eversion stress, we've already done it by doing this. Kliger's was actually eversion like this. What the Kliger's test is doing is it's actually trying to separate these two bones. Okay, so remember when I told you that this is the interosseous, okay, this is the tissue in between these two bones. At the very end of it is what we call the syndesmosis. All right, that is holding these two bones together. It's like a ligament, but it's part of this whole big tissue. Does that make sense? All you guys look like you're okay. All right, so basically, it's right there. And what happens is when somebody sprains their high ankle, they sprain this. They don't sprain this. They sprain this. If they sprain this, and I do this and this hurts, I can put a brace on them, I can tape them, I can do all sorts of things to shorten this ligament, and they can actually play. As long as they have the strength, they can actually play with this. But if they have this, the thing that hurts the most is when they separate these two bones. And you know the way they separate it? They separate it by pushing off. When she pushes off and these two bones come apart, that's a high ankle sprain. It's a lot harder to tape that because I can't stop that from happening. I can stop this from happening. I can't stop that from happening. So when somebody has a high ankle sprain, what happens? You get very little swelling. So everybody, that's why you guys are taping all this. I know you're getting bored holding your phones, but I can't help you on this. I got to explain it to you. So if they've got these ligaments right here, and this is separating every time they push off, and there's very little swelling, there's not a lot of therapy I can do for them because I'm not trying to get rid of inflammation anymore. And so what happens is when I push like this, and I'm testing this, if it hurts on this side, it's that deltoid ligament, but if it hurts on this side, then that means it's probably a high ankle sprain. Does that make sense? I'm pushing this way. I said, does this hurt? And she says,